our last speaker, but certainly we've saved one of the best till last, Dr. Soheb Rehman. Many of you will know him through all the extra hours he puts in helping you guys on social media, on various groups. He is a fountain of information for IMG doctors and never hesitates in terms of disseminating information or sharing his knowledge. He's currently a GPST1. Could I introduce Soheb? Hi, Soheb.
Hi, Pooja. Hi, Aman.
Great to see you, sir.
Same here, same here. Are you able to see my screen?
Yeah. Looking forward to some gems from you today.
Oh, okay, let's see. There are all of the speakers before me. They were so great. I had nothing to show in my CV. I'm just a trainee at the moment. But yeah, so I'll introduce myself again. My name is Soheb. I'm one of the GPST1 trainee in Northwest at the moment. And I'm also a representative in Junior Doctors Leader Group locally. I've been helping IMGs for past 4 years. So the idea started with the fact when me, along with my 2 other colleagues, when we started our journey, it was so difficult and time consuming to find answers to our questions like what visa to apply, how to prepare for interview, and on and on, how to prepare for PLAB 2, how to prepare for PLAB 1, and how to secure job and what visa to apply after job. So one of our senior, Umar Alam, he decided to start a blog, and later Nasir, and then I joined. And that's how we started a page and started helping each other. Nowadays, it's so easy. You've got Facebook pages, you've got Aman, you've got a few other people who are helping by giving everything on a plate to new international medical graduates, and that's really commendable. So my presentation would be, I'll answer a few common questions that that is being asked on a regular basis on different pages again and again. And after that, I'm happy to answer as many questions as possible. Yeah, I'll start with the first one. I think this was the question which was asked from BMA visa representatives group. The question was regarding to clinical attachment.
Soheb, once just before you go forward, when I put your screen on large view so people can see, yeah, just that's perfect. Yeah. Perfect.
Okay, so clinical attachment. The question asked was, what sort of visa is required for clinical attachment? The answer is it's visit visa. So anyone who want to do a clinical attachment, they have to apply for visit visa, and in subcategory, they have to mention that they are coming to the UK for clinical attachment. And as per visit visa regulations, you are allowed to do any course, any sort of activity, observership, clinical attachment for a maximum of 30 days. So 28 days of one clinical attachment is allowed per visit visa, not a second one. So that is the answer. Is it must to do a clinical attachment to get a job? I would say not must, but it's preferred, because nowadays there is so much competition for a single job. There are so many applicants. Most of them have got postgraduate qualification like MRCP, or they've got 2 or 3 years of experience after their graduation. So yeah, it is good to have one, but it's not must. Still, people are securing job without clinical attachment. How to get one? I think the easiest way is to ask your friend who is already in NHS to just speak to the different consultants, and most of them would be happy to allow you to start clinical attachment with them. If, let's say, if I am someone who is planning to do a clinical attachment, I would ask someone who is already in NHS to get me email IDs of few of the consultants so that I can email them, and I would request my friend to get in touch with those consultants. Second would be to search different hospitals online, find the email address of HR, and you can just Google NHS hospitals in London, NHS hospitals in Birmingham, NHS hospital in Scotland, a list of hospital will come. Click on the hospital, find a contact of HR, call them or email them, and they will let you know if there are opportunities for clinical attachment. In every hospital, in every teaching hospital, there is a designated person for clinical attachment and observership for medical students and those who have done their medicine. So there is a designated person always and always. It depends on how serious you are and how much effort you put to get one. And when to do one. I think the best time to do a clinical attachment is after your PLAB 2. As soon as you appear for PLAB 2, the very next day you should start your clinical attachment. So by the time your result is back, you would have done your clinical attachment, and then you would be in better position to move forward. If someone is not able to get clinical attachment, because few hospitals say that we will only allow clinical attachment once you're GMC registered, then you have to wait for GMC registration. Is it worth to spend fortune on clinical attachment? I think yes. Nowadays, with so much competition going on, yes. If it's a few hundred quid or 1,000, you don't need to pay them. There are few hospitals which are charging 500-600 pounds for clinical attachment. You don't need to pay them. Search hospital which offer free. 96-97% of hospitals would offer free, but then you have to pay for your accommodation and food. Now, second question, can and should I join GP training directly? This is the most common question which IMGs are asking these days, because everybody wants to get job as much quickly as possible. As soon as someone gets GMC registration, their expectation is that NHS clinical leads would be lining in line to offer me job as soon as I get GMC registration. No, that's not true. Nowadays, it's taking 2 months from 2 months to a year to secure a job in NHS. So guys, have patience, apply for non-training job as soon as you get your GMC registration, and then give some time to yourself to see if you're getting one or not. If you're not getting GMC registration, non-training NHS job, you can apply for training. So the question is, can I join GP training directly? Answer is yes, you can. You don't need to have an NHS experience to join GP training. Although on a website and in GP training application, it says 12-month experience post GMC registration or 12 months experience in NHS, but we need GPs, and hence there is leniency around this clause. So if you satisfy a criteria of 24 months of work experience, anytime in your life, you can join GP training. The second part, should I join GP training directly? If you would ask me, I would say no. If you would ask any trainer, any GP who is working in NHS this question, the answer would be no. You should not join GP training directly. The reason is, when you join training, let's say when I started my GP training, my first rotation was pediatrics, and I had to start on nights. There is no excuse to tell them that I cannot start on nights. Who will start on nights then? Somebody has to start, and I got a track. My rota was like that. I cannot decline to start on nights, although I had NHS experience, but it was tough for me. So imagine you're coming to the UK, your first NHS job, your first rotation is either pediatric or gynae or A&E, and you're starting on nights. Your registrar would be more than ready to help you, but then there are certain limitations. So it's scary. However, if you're starting on a non-training job, there would be proper induction. There would be proper support for you in the start. Now this year, I think 30 to 40% of GP training who are starting GP training from August, they are from abroad, and it's their first NHS job. And deaneries across the UK, they're just losing their mind. They don't know how to help them. They don't know how to support them. There is no proper program. for the past 2 months, and in coming 1 month, they are trying to design a program to support these new IMGs. But still, it's tough. It's tough to start directly in training, because when you start ST1 training, it means you know how NHS work, because you submitted your crest form, and in crest form you declared that you are equally competent to FY2, who knows how NHS work. So make your decision wisely, please. Prerequisite for GP training application, two main things that are needed. I'll go to the second one, 24 month of work experience. This work experience includes your 12-month of internship and then 12-month more work experience anywhere, anytime. If you had 24 months of work experience 10 years ago and then someone took break to raise family, to raise kid, still they can apply for GP training program. So 24-month work experience anywhere in the world at any time in your natural life. And then second is crest form and latest crest form. So there was a crest form that was released in 2012, and it was the same crest form that was valid till 2018, again and again, no new changes. But since 2018, Health Education England is releasing new crest form on yearly basis, and it says that you have to sign the latest crest form every year. So someone who is going to apply for January, like a GP training for next year, they have to get new crest form signed, which will be released in October, probably October or November. So wait for that and get that form signed. And that crest form actually means that you are having capabilities equivalent to FY2, Foundation Year Trainee 2 in the UK. So make sure that you go through the crest form and make sure you do everything that has been mentioned in crest form. Yeah. Can I get my crest form signed from abroad? This is the another question which everyone asks. Yes, you can. Who can sign it? Any person who is registered as specialist under the medical council of any specific country can sign it. The person who is signing it doesn't need to have MRCP, doesn't need to be in UK. A person who has done FCPS or FRCP in any country can sign it if they are registered as a professor, assistant professor, associate professor, or as a specialist in the medical council. If you are getting crest form signed from abroad, you have to attach the what it says, you have to attach the registration certificate of a person who is signing it, which should mention that they are registered as specialist. So, but the question is it possible to get crest form signed from someone from a consultant who is in Middle East, who is in Pakistan, who is in Sri Lanka, who is in Nepal, who is in India? If you ask me honestly, I don't think so, because the things mentioned in crest form, like a discussion around DNA CPR, a discussion around end-of-life care, the practicing medicine according to the GMC guidelines, I don't think so that is happening anywhere apart from UK or Australia or Canada or few other countries or in Europe. But it doesn't mean you cannot get those things signed. If you can show to your consultant, you know these things, you can demonstrate these things, then you can get it signed. Another questions which people usually ask when they get their GP training slot, which rotation I should select for my GP training? It frankly depends on your previous experience. If you have worked in peds, if you have worked previously in gynae, if you have worked previously in medicine, if you have worked previously in A&E, you don't need those rotations. You can go for other rotations which you think would benefit you, like psychiatry. Like if you have done pediatrics before, you don't need more pediatrics. You can go for psychiatry, gynae, you can go for A&E. But at the end of the day, what you will learn in pediatric ward, what you will learn in gynae ward is completely different from what you are going to see in primary care. I had my pediatric rotation. What I did was to look after seriously unwell kids. But in primary care, I'm seeing something else. However, that rotation helped me to gel well with my patients, uh, to examine my pediatric patients very confidently, to identify unwell children. The bottom line is you don't need to worry if you don't get any rotation which you want. If somebody has not done a pediatric rotation, still the primary care rotations of 2 year would give you sufficient exposure to almost everything. Like I have had no exposure to dermatology in my 3 months of primary care rotation in ST1. I've seen so much, not that much, but I've seen sufficiently that I can navigate through various resources to identify or to see what I can do for my patient. If not, then I just grab my other colleague to come and have a look. So you don't need to worry. Another question which most of IMGs ask, which is the easiest specialty to get in? And you'd be amazed to see that most of the answers include GP training is the easiest specialty to get in. However, that is not the case nowadays. GP has become way much competitive now. This year, there were 7,000 applications for 3,800 seats. And good and bad news is bad news because there won't be sufficient seats for round 2. Good news, all 3,638 seats got filled. Now, when the people who are asking this question, they want something that is easy and they don't know what GP training is. Is GP training easy? No, it is not easy. It is way more tough, way more compact. It is way more congested than any other specialty. You will become a medicine consultant in 7 years, and you will become a primary care physician in 3 years. You have to know almost everything about everything in primary care, and that's how difficult it is. The exit exam of GP training, that CSA or the latest one on which everything will have to record and camera, it is way more difficult than the exit exam of cardiology or neurosurgery. So it is not an easy specialty to go through. This is what I want to convey. But yeah, it gives you way more flexibility in your life, an excellent work-life balance. You can work for 2 days, you can work for 3 days, you can work for even 1 day. It's entirely up to you, but it is not an easy specialty. I think this is the last slide or second last, yeah. What will happen if I complete my training and I don't have ILR? There are 3 options. Let's say if you complete your GP training and you have spent only 4 years in UK and you are still left with 1 year to get your ILR, then there are 3 different options. One is to get your tier 2 visa via different sponsoring CCG. Once you are ST3 and you're done with your exit exam, you can email your deanery, you can email Health Education England to send you a list of different areas and different CCGs and surgeries which can sponsor tier 2, and they will let you know how to navigate that and how to get tier 2 sponsorship after your CCT, and they're quite helpful. Second is, let's say if you are living in a particular area, central Manchester, and you're bound to that area. You've bought house, you've got kids, and you don't move, and you cannot move from that area. In that case, it becomes difficult because tier 2 sponsoring CCGs and surgeries are usually in the periphery, very rarely in main cities, and in main cities it's difficult to get your first job. Also, in that case, you can work as a registrar in a non-training job, let's say in A&E In medicine, you can work as a registrar. You can complete your ILR period and then apply for ILR. Or just hold on for a second. Charger for it. Third way, like in my case, I'm the most unlucky person. I'll become eligible for ILR with a difference of 1 day after completing my CCT. In this case, what you can do, you can extend your training by going less than full time in your ST2 or ST3 or ST1. I have a plan to go for less than full time just to complete my duration for ILR and apply for ILR. This decision is not wholly solely based on getting an ILR. I also want to extend to get more exposure to primary care. When applying for LTFT, you should not mention that this is the reason, because you won't get LTFT for that. The third option is least preferred one. Can I do training job on dependent visa? Previously, it was not allowed. So anyone who were on dependent visa, and when they had to start training, they had to switch to their own tier 2, and that would reset ILR clock to 0. Imagine most of the doctors who had to go through this were female. They came to the UK 2-3 years ago. They were dependent on their husband's tier 2. They stayed in the UK for 2 to 3 years. They got their training job, and when they applied for training visa, their ILR clock resetted, and it was a nightmare because they had to spend 5 years more to get their ILR. From December 2021, the UK Visa and Immigration Department has made changes. Anyone who has got tier 2 dependent visa December 2020 onward, their BRP won't have this restriction. So nowadays, anyone who is coming on tier 2 dependent visa, they can enter into training, GP training, IMT training, or any sort of training without applying for new visa, and it won't reset your ILR clock. So can I do training job on tier 2 dependent visa? Yes, you can. These are current rules and regulations. What will happen in future? I don't know. I think it is going to stay like this. So yeah, these are the common questions which are usually asked on different forums. If anyone has any questions and they want to ask, I'm more than happy to answer.
Thanks, Soheb. That was really helpful. We've got quite a few questions coming through. But yeah, very, very useful. All those questions, you're right. We just see them all the time on repeat. And it's good that you can clarify these couple of things. And I think there's a few follow-on questions, and there's a few completely different ones as well. So we'll see what you can cover. Pooja, have you got anything to kick off with?
Oh, Soheb, you must be used to all these questions. What are the challenges an IMG with 3 to 4 gap years have to face in the UK and NHS, and how would you recommend they navigate those challenges?
So challenges for a person who is out of clinical practice for 3 to 4 years, it's different from someone who is already working. One, you have to strengthen your knowledge in addition to knowing how NHS work. I'll give my example. When I came to the UK, I was lacking medical knowledge because I was on a non-medical side. I was doing my master's in biochemistry, and when I came, I had no idea how to approach patients. Although I cleared my PLAB 2, I cleared my PLAB 1, but that was theoretical knowledge. When I was preparing for PLAB 2, it's mostly you practice with your friends, you don't see patients, and that was the main thing. When I was exposed to my first patient, I was like, okay, I'm back to my internship. So the main challenge is to how to strengthen your knowledge, how to approach your patients, how to how to become confident in examining your patients. How to overcome it is to do clinical attachment and observership. If someone with a gap of 3 to 4 years are applying nowadays, it is very much difficult to get a job directly unless someone do clinical attachment. If someone is in the UK, I would advise them to get clinical attachment. Just grab your CV, visit a hospital near to you and ask them that you want to do clinical attachment. If someone is not in the UK and abroad, they should start working as a doctor as soon as possible. The second thing which they would struggle is how to understand how NHS works, and it takes around 4 to 6 months. No book or no form of guidance can tell you to know how NHS works. It's just your experience. You'll get a book in which it will mention that this is the job of occupational therapist, this is the job of physiotherapist. But when you go to the ward on first day, you'll see a physiotherapist and then you'll forget what they do unless you see them what they are doing. So yeah, I hope I've answered the question.
Yeah. There's a few questions about visas, Soheb. So feel free to say if you're not sure, because it's quite can be a tricky topic, I suppose. So on dependent visas, can I take up non-training job positions? Firstly?
Yes.
Can a
they
training
can do
job be
locums
done?
even.
Okay. Can training jobs be done on dependent tier 5 visa?
No.
Short and sweet.
No.
Vijay?
No. So tier 5, if they've got tier 5 before December 2020, they can't. And I think the tier 5 dependent visa, which is issued after December 2020, still mentions that no training job. So I've seen few people, they've asked me, when I've asked them to show me their DRP, it still mentions that no, they can't.
Okay.
So just let us know if this is something you can answer, Soheb. So somebody's saying, I'm interested in anesthesia. I only worked for 2 years as a postgraduate. I don't have a specialist certificate. Which route should I take after I'm done with PLAB and GMC registration?
So once you are done with PLAB and GMC registration, just enter into the NHS, any job. It's highly unlikely someone would offer you a job in anesthesia non-training directly unless you have got someone already working in NHS who can somehow find a position for you. Second thing would be you can go on NHS jobs or track jobs and see if there is any anesthesia SHO position. I don't think so. There is anesthesia SHO non-training position. Anesthesia is a very delicate technical field, and they do not hire non-training jobs. There is a route which is called International Clinical Fellowship, in which NHS hires directly from other countries. I think India is the only country from which they can hire international clinical fellows for anesthesia. I've met few who are working in anesthesia via that program. So that is one route. Second is enter into the NHS, work as an SHO in any field, and then get to know the system, prepare your application for anesthesia, and then apply. I know plenty of people who are working as anesthesia trainee nowadays who have got their training in last 2 years via this route. This is the easiest one.
Brilliant. Well, we really appreciate you sharing your knowledge, Soheb. It makes a difference to so many people, and especially taking time out on a Saturday when you've got a busy GP trainee schedule as it is.
Oh,
yeah, really appreciate.
Happy to help.
People are asking where can they ask you further questions, Soheb. So Soheb is a member of our GP training support group, which I'm going to put in the chat now. So he often answers questions that people have Sometimes people ask me anonymous questions because they don't want their name to show, so they're in the group, and Soheb kindly answers quite a few of those. So I'll just put the link out for that group, and then you can ask any questions related to GP training in there. There's also the main International Medical Graduates group that Soheb is an admin for as well, and you can ask questions in that as well. And Soheb, any other people are saying, is there any social media handle that you have that they can contact you on directly?
They can ask me questions on Facebook. You can share my profile link with them. I'm happy to answer.
Fantastic. But please, please, Soheb does all of this of his own goodwill, don't you? So if you don't get responses within 30 seconds, it's because he's working as a GP trainee as well. So give him a little bit of time to answer it. But he is great. He is great.
Thank you, Aman.
Great. So I think we have got a few questions, but they've been covered already in the talk. So we will be putting this talk back out live on YouTube and Facebook, so you can watch this back and go through all those things that Soheb shared, because they are super useful. And you know, once again, we really appreciate it. Really appreciate you coming on and doing it.
No, thank you, Aman. Thank you, Pooja.
Great. Thank you. Thanks, Soheb.
Bye.